New question. The member from Newmarket Aurora.
My question is to the Premier. The Health Minister this morning, when asked what the budget is of Ornge and whether she knows what the annual payments are for the $275 million bond offering, responded by saying, "Is this a quiz?" Speaker, it's actually very serious business. I want to know from the Premier, does she think it's acceptable for her Health Minister not to know what the annual budget of Ornge is and not to know about a $20 million annual payment that Ornge now has to make on a $275 million bond offering? Is that the kind of competency and transparency and oversight that she expects from her Health Minister?
Thank you. Premier.
Thank you very much, Mr. Speaker. Well, you know, Mr. Speaker, the member opposite has been a Minister of the Crown. He knows what's entailed in doing that job, Mr. Speaker. He has not been the Minister of Health, which is a $48 billion ministry, Mr. Speaker, so he actually doesn't understand what it takes to transform a system like that. He actually doesn't understand what's necessary in terms of the ability to evaluate evidence and to understand.
The Minister of the Environment will come to order. The member from Cambridge will come to order.
Speaker, what I think he does know is that the Minister of Health, and Long-Term Care has a responsibility to make sure that we have a health care system that is sustainable over the long term. And in order to do that, Mr. Speaker, we have to make changes. And those are the kinds of changes that this Minister of Health is making so that the member opposite's children and grandchildren who live in Ontario will have a health care system when they need it.
Thank you. Supplementary.
Well, Speaker, I think the first change that should be made is a change for the Minister of Health, because for the Minister of Health not to even know what the annual budget of Ornge is, this is an agency, an organization that has been under the scope of a Public Accounts Committee for 2.5 years. One would expect that at the very least she would know what's going on in that agency, but she doesn't. And so I'm asking the Premier one more time to transform the health ministry of the province of Ontario. How can she count on a minister who doesn't know the fundamental issues relating to Ornge? How can she expect that minister to do her job when she demonstrates that kind of incompetence every day, every hour of the year? How can she possibly expect transformation to happen?
Be seated, please. Be seated, please. Thank you. Premier. Senator Hastings will come to order. Carry on.
Thank you very much, Mr. Speaker. Because the fundamental issue that this Minister of Health and Long-Term Care had to deal with was to make sure that the changes were in place so that there would be the appropriate oversight at Ornge, Mr. Speaker. That's why we reintroduced Bill 11, Mr. Speaker.
Member from Northumberland, come to order.
Ornge is more accountable, that there is a system in place that makes sure that the correct monitoring is there so that that situation won't arise again. That's the fundamental, Mr. Speaker. That's the policy issue that the Minister of Health and Long-Term Care is responsible for, and that's the policy issue that the Minister of Health and Long-Term Care is dealing with. That's why she reintroduced Bill 11, Mr. Speaker, and the member opposite knows full well that it's support for that kind of oversight that he should be putting forward, Mr. Speaker.
Final supplementary.
Well, Speaker, it's interesting that that bill has not been called back for the legislature to deal with. Why not? There's been lots of time. We haven't seen this bill in this House if that bill is so important. Again, why isn't the Minister of Health doing her job? Why isn't that bill in the House for debate? Why hasn't that bill been passed if, in fact, it's going to make the difference? I'm going to ask the Premier to refer this question to the Minister of Health. Can the Minister of Health tell us if between the public accounts hearing this morning and now, has she found out what the budget of Ornge is for this fiscal year? Can the minister tell us?
I said 152 in committee.
Thank you very much, Mr. Speaker. I believe that the Minister of Health and Long-Term Care gave the number. She said 152 million in committee, Mr. Speaker. My understanding, if you check Hansard, I think you will find the number there. But, Mr. Speaker, you know, the member opposite talks about bringing a particular bill forward. What he doesn't talk about, Mr. Speaker, is that the procedural games that are being played in the legislature, Mr. Speaker, it's very difficult. It's very difficult from the outside to look at what's happening within House Leaders' meetings and across the floor. But the reality is, Mr. Speaker, that there is procedural wrangling that's going on. It's very unfortunate. We are working very hard to make the minority parliament work, Mr. Speaker. It would be fabulous to have two partners in that, in the opposition and the third party.
Thank you. Your question, the Leader.